Hey, Facebook, we wanted to come to you and talk a little bit about cupping. So Nori recently got trained and certified in the use of cupping within massage therapy appointments, and we wanted to show you about it, talk about what it is, why, how, when, and where. When in doubt, put a cup on it.
Well, not always, but
no. Well, she knows. So go ahead.
Okay.
Yeah, I'm gonna have her show on myself too. So we're gonna, I think, do like forearm and arm. I get some hand, wrist, and thumb pain, as most of you know, from squeezing all your muscles. And so I'm gonna see. Then you can see kind of what happens to the skin, what it looks like, and how it acts.
Yeah. So cupping therapy, when people ask me what it is, I usually reference Michael Phelps. That is the pop culture reference that most people know it from. When Michael Phelps was swimming in the Olympics and he had those big, perfectly circular hickey marks on his back, that's what it's from, cupping. And athletes really love this stuff.
Yeah.
And if you haven't had it done, I can describe it best as saying that it's negative pressure therapy. So a lot of times, like if you have a trigger point and everybody has a pain right here, you know, you're like, oh, my shoulder hurts, and it's right here. So a lot of times when you have that trigger point, I'll spend a lot of time applying some deep pressure to it. And maybe I'll move your arm around a little bit. Maybe I'll ask you to move your arm around a little bit so we can shorten and lengthen that muscle while I'm putting pressure on it. And then if I do that for long enough, I'll feel a little bit of a pulsation or a fluttering under my fingers, and that is the trigger point releasing, if we're lucky that day, depending on how long it's been there. So this, instead of putting that pressure in like we're used to, like that definitely still has its place and I do it all the time. This really helps me do a little bit less of that, which is good because that trigger point therapy can be really uncomfortable, as you may well know. So this, by putting the negative pressure on it, it's lifting the tissue instead of compressing it. And by doing that, it's bringing a lot of fresh blood into that area. Trigger points are usually blood deprived because the muscle's so tight, blood can't really get in there to give the muscle the nutrients that it wants. So by bringing the blood in there, it gets the trigger point primed to be released. So it's nice and juicy, and then I can go in and it takes much less work to let it go.
Yeah. So what's awesome, and while she does this, I'll chat. So what's awesome is, you know, for instance, the other day, I was having some pain in my mid-back, and Nori was having some pain in her hip, and we said, perfect, let's take care of each other. We'll trade and do this for each other. So we, you know, we basically did a little bit of therapy and then stuck some cups on my back, and then we, I was able to work on her, and by the time we took them off, the pain was relieved, and I had the classic sort of markings from the cupping. A big thing, like she said, is tight muscles. They need fresh blood supply brought to them. They need fresh blood supply to the area, and they need that blood supply to usher out waste products to get the inflammation and pain down, and to usher in fresh nutrients that assist in healing. So as you can see, we get these kind of suctioned on here, and that's why they create the classic sort of ring marks that are almost hickey-like in presentation. Is that really the only way to? Yeah,
it's not a bruise.
It's not a bruise. It's not painful at all. Well, maybe the suction can be a little.
When you first put it on, it feels a little bit like somebody's biting you.
Yeah,
I promise no one is.
It's grabby for sure. Let's zoom in to it.
How sensitive it feels to you will diminish over time. Like it feels really pinchy when it first goes on if it's on a sensitive area, and then that sensation will fade over the next minute or two.
That's my skin here. So I'm feeling definitely like some pulling here, but that's also where I'm really tight and sore from all the work.
And so like it's hard for them to like really stick on these tight muscles sometimes. And so a lot of times with these, I'll do some gliding, and it's really nice to feel that lifting with a glide. It's really good for fascial release.
So she'll physically move the cup
along. And you can tell where the fascia is tight. It's really hard to drag it along that skin. But after a few passes, it becomes a little bit easier.
Yeah.
And I think, can I put one on your shoulder?
Yeah.
To demo? Because this is I'll do this right here. Is that good?
Yeah.
Okay. So the oil that I'm using, by the way, as lubrication for this is jojoba seed oil, which I really like because it has a nice medium viscosity. It's not too greasy. I do towel you off before you leave my office, so you're not going into your day looking like you haven't showered when you have. The reason I mainly like jojoba seed oil is because it's completely hypoallergenic. Nobody's allergic to it.
Yeah, that is good.
So right now, I'm putting a cup on Sarah's levator scapula, which is that muscle I talked about hurting on everybody. This is that jerk muscle when you're feeling anxious or stressed. It raises your shoulders up.
Everyone says, I carry my tension in my shoulders.
And
Then
like,
you
"Oh,
might need a
really?"
cup on your shoulder.
So this feels really good just sitting here. It can feel good if I move it around back and forth. And then while that's sitting there, I might take Sarah's arm and bring it through the range of motion, so that this tissue is being lifted and sucked up. And then by moving this through the range of motion, I'm lengthening that muscle and the fascia on top of it.
And, so there's all kinds of places all over the body where these can go, on the chest, on the back, on the arms, front and back, on the hips, thighs, low back, glutes. So a lot of times when you just can't get a muscle to release, we can only dig so hard. And some people, I get this a lot, they say, oh yeah, dig in there. The more you compress, the better. It's a misconception that we have to work harder ourselves to dig in there. And when there are tools that do it so nicely and effectively, if I'm laying on a table right now getting work done, she can break and work on my low back and hips.
This can cook while I'm doing something else.
While this just sits and does its job.
And so, some of my clients may not believe this, but my primary goal is to not hurt you. I don't want to cause you pain.
Right. We do whatever is necessary to get you better, but it doesn't have to hurt. But so as you can see, definitely a puffy area, some discoloration here. Again, no pain whatsoever, and oh my gosh, that feels better.
Mm-hmm. Oh. So this puffiness that you see is just from the indentation of the cup here. The puffiness will start to fade in like 5 minutes.
Yeah.
And then the pink mark that it leaves behind, pink, red, it can go all the way up to purple. That can last anywhere from a day, a couple of days, to a week or two, depending on what was going on in your body.
But yeah, so it's gonna look like this, but it's not gonna hurt at all. I mean, unless maybe some minor discomfort, but nothing like the pain that you have that got you to where you needed it, or maybe even just similar. Oh, look, Melissa's watching. Hi, Melissa. We love cupping too. She loves getting it done. And so it's really just a nice, effective way to, so much more relaxing. Not that pink.
Not that pink.
All right.
But yeah, I was working on someone earlier who had a not a severe, but a really noticeable muscle strain in the deltoid, and I was doing what I usually do: my myofascial release, my cross fiber friction, my trigger point therapy, and he was just dying.
Yeah.
So I put a cup on it, let that cook for a couple minutes, and when I went back to it, he was in much less pain, and I was able to get a lot more work done in a shorter amount of time to get him into some pain-free range of motion.
What about even like feet? What about like plantar fasciitis? Which, by the way, if you can't see this, it's hard to tell. No, I was just saying, I was talking about feet. So feet and plantar fasciitis and calves and things like that, you can do them on too, right?
I can.
Yeah.
I won't do it unless someone asks. There's areas of your body that are a lot more sensitive to this cupping pressure.
Yeah.
Somebody worked with a cup on my IT bands one time, and I was screaming.
Yeah. So we'll do it to your comfort level, for sure. But I know you guys can't tell right now, but I have a lot better flexion on my wrist. I've got some restriction in this right side, but I'm able to really move further now on the left. And then even this is just feeling so much better. So shoulders nice and relaxed. So it really can work on so many different things.
Yeah. Ooh, I love using it on my ribs.
Yeah.
We both get really tight diaphragms in the work that we do. We're always pushing forward. People who are always on your computer, you're like this. Pecs. It's really great on your pecs. For getting your shoulders
back and loosening all of this up.
But yeah, gliding along the ribs is really good, and you can even use it for abdominal massage. If you have constipation issues, you can get things moving.
Yeah, so lots of good stuff. Feel free to come in and check it out. And if you have any questions, let us know. We're here to help and to answer.
Thanks for having me, Sarah.
Yeah, thanks. I feel like I have a talk show. Thanks, guys. Have a good day.